Now we go to the 5 transporting points, the Jingwell points, pericardium 9. Pericardium 9 location on the most distal point of the middle finger. How to find? Find the most distal point on the tip of the middle finger and there locate the PC9. Needling, vertically 0.1 to 0.2 tune or prick to bleed. Caution, this is a painful point. For the action indication, PC9 clears heat, especially from the heart and pericardium. It strengthens collapse yang, expels internal wind. For the special features, PC9 is a Jingwell point, wood point, tonification point. PC9 is mostly used to clear heat, either in chronic conditions with mental symptoms or in acute cases of heat at the nutritive Chi level. It also extinguishes interior wind and restores consciousness and is used in acute wind stroke together with all the other well points of the hands. PC9 clears heat and restores consciousness for those having fever, loss of consciousness. It extinguishes interior wind, those having with wind stroke. It also calms the mind, those having agitation, anxiety, palpitation, or insomnia. PC9 is a Jingwell point of the pericardium channel, and in common with many of the Jingwell points, the terminal and most dynamic point of the channel has a powerful effect to restore consciousness. There are some particular differences, however, that distinguish PC9 from the other Jingwell points. First, located on the middle finger, this is the most distal of all the Jingwell points and the only one located in the center, rather than at the corner of the nail. Secondly, as a point of the pericardium channel, PC9 is especially suitable for restoring consciousness, which occurs when the spirit is dislodged from the heart. Loss of consciousness with stiffness of the tongue may occur during the course of the febrile diseases when pathogenic heat complicated with phlegm collapses into the pericardium. The affinity of PC9 for the tongue reflected in such classical indications as pain at the root of the tongue, stiffness of the tongue, and inability to speak underlines the intimate relationship that has held to exist between the pericardium and the heart. Since it is the heart which flowers into the tongue and the heart channel rather than the pericardium channel that travels to the root of the tongue. Like several points of the pericardium channel, pericardium 9 also treats injury from the summer heat characterized by fever, agitation, vomiting, diarrhea, and collapse. The pericardium primary and divergent channels traverse all three jaw, and the pericardium is exteriorly coupled with the sunjaw channel. Like many points of the pericardium channel, therefore, pericardium 9 also has a strong action on the middle jaw and is indicated for vomiting and diarrhea, epigastric pain, and sudden turmoil disorder. In the treatment of pediatric disorders, it may be used for nighttime crying in children and childhood nutritional impairment. Among other patterns, the former may be due to accumulated heat in the heart and later to heat and blockage in the middle jaw. As the tonification and wood point, ZHONGCHONG will invigorate the meridian and regenerate the spirit. It brings movement and breaking through the stagnation where there has been depletion and stockiness. Rushing into the middle gets the chi moving, releasing a surge of chi in the meridian. It can lift the spirit, provides more fuel and nourishment for the fire. The pericardium is the direct route to our heart center. PC9 activates this route. The mother-child connection along the Sheng cycle makes this a nurturing yet vigorous point. When the heart protector has been stopped, more so without hope and too beaten down to make a fresh start. This point can help prompt new beginnings, hope, and clarity about direction. As a Jingwell point, one use of this point is to clear pathogens, wind, and heat from the pericardium. Also, a Jingwell point, it can restore consciousness and particularly effective in doing so. Having such a direct connection to the heart and being the most distal point, it can effect a sudden change of mood as the fast-acting distal Jingwell point. This point is mentioned for its effect on the tongue. Although it is the heart itself that opens into the tongue, the closely bound role of the heart protector is reflected in this use of the point, as well as this being the most distal point on the pathway, which gives it a strong effect on the opposite end of the meridian. The connection of pericardium and the liver as Yin also means it affects the middle jaw and stagnation of qi in the chest. When the arms are raised, traditionally known as the Chinese anatomical position, this is the highest point on the body. This point brings energy from the mother to the child via the Sheng cycle. Works directly on the mental level but can lift the spirit too. For unconsciousness or fainting, cutting off the mind from the body. Consider where the hands are hot or cold. May be beneficial for uncontrollable sexual habits with lack of affection or for people who have difficulty expressing themselves. An often used point because wood commonly has more available energy in it than fire. Thank you for your attention.
Let's discuss kidney 3, a Yuan-source point. Kidney 3, or supreme stream, is located in the depression between the highest prominence of the medial malleolus and the Achilles tendon. How to find kidney 3? Locate the highest prominence of the medial malleolus. From there, palpate horizontally towards the Achilles tendon. Kidney 3 is located in a depression that can be palpated anterior to the tendon. Needling vertically 0.3 to 1 Sun. Actions or indications. Kidney 3 nourishes kidney yin and clears deficiency heat. Tonifies kidney yang, stabilizes the kidney qi and the lungs, helping the kidneys absorb the qi, regulates menstruation, strengthens the lower back, and it is a local point. Special features: Yuan-source point, shoestring point, earth point, an important point for tonifying the kidneys, especially kidney yin. Kidney 3 is an extremely important point used to tonify the kidneys in any deficiency pattern of kidney yin or kidney yang. It tonifies every aspect of the kidneys, that is, kidney yin, kidney yang, kidney qi, kidney essence, and the kidneys receiving of qi from the lungs. Being the source point, kidney 3 is in contact with the original qi of the kidney channel. And since the kidneys are the foundation of all the qi of the body and the seat of the original qi, this point goes straight to the core of the original qi. As the kidneys also store essence, kidney 3 can tonify the essence, the bones, and marrow. The main difference in the tonification of kidney yin or kidney yang is in the use of moxa. Moxa is used to tonify kidney yang. Kidney 3 is one of the main points to tonify the kidneys together with bladder 23 and REN 4. Essence nourishes the uterus, and this point can regulate the function of the uterus. It is therefore used in irregular periods, amenorrhea, and excessive bleeding. The kidneys rule the lower back, and kidney 3 can be used to treat any type of chronic ache of the lower back. Kidney 3 tonifies the kidneys, both yin and yang. So this is particularly useful in backache, dizziness, tinnitus, exhaustion, feeling cold, frequent urination, cold and weakness, dry throat, night sweating, hot palms. Strengthens the kidneys receiving of qi. So cough, wheezing, breathlessness. It calms the mind, so it's very good for insomnia, excessive dreaming, poor memory. Benefits essence: seminal emissions, nocturnal emissions, impotence, premature ejaculation, weakened sexual function. Kidney 3 strengthens the lower back and knees, so it's particularly useful for lower back ache, weak knees, achy knees, cold legs. And kidney 3 regulates the uterus, irregular periods, infertility, scanty or heavy periods. The kidneys occupy a unique position among the Zangfu, both storing the yin essence and conserving and controlling the Mingmen fire. The kidneys are thus the root of the yin and yang of the whole body. Because of this fundamental role, deficiency of the kidneys may both cause and result from disharmony of any of the other Zangfu. The spiritual pivot in chapter 6 recommends the use of the shoestring points in the treatment of disorders of the Zang, whilst in chapter 1 it says, when the 5 Zang are diseased, select from the 12 Yuan-source points. Kidney 3, the shoestring and Yuan-source point, is therefore the principal point on the kidney channel to treat disharmony of the kidney Zang, which, due to the unique nature of the kidneys, always involves deficiency, principally of kidney yin or kidney yang. Kidney yin deficiency may affect the kidneys alone or by failing to nourish the liver, heart, or lung, all of which are reached by the kidney channel, affect this Zang also. Yin deficiency may manifest in 2 main ways: failure to nourish and moisten, or failure to restrain fire. The art of treating yin deficiency lies in carefully assessing the relative importance of these 2 aspects and placing appropriate emphasis on nourishing yin and cooling fire. Thank you for your attention.
Let's now talk about bladder 58, the soaring upward point, a loop connecting point. Bladder 58 is located 1 tune distal and 1 tune lateral to bladder 57, or 7 tune proximal to bladder 60 at the posterior border of the fibula and at the lower border of the gastrocnemius muscle. How to find bladder 58? First, locate bladder 57 in the center of the calf between the 2 bellies of the gastrocnemius muscle. From bladder 57, palpate 1 tune in the distal direction and 1 tune in the lateral direction. There, locate bladder 58 on the lower border of the gastrocnemius muscle. Located on the same level, which is 7 tunes superior to the highest prominence of the lateral malleolus, or GB35 at the posterior border of the fibula, GB36 at the anterior border of the fibula, and stomach 39, which is 1 tune distal to the midpoint of the line connecting stomach 35 and stomach 41, and 1 finger breadth lateral to the anterior crest of the tibia. Bladder 58 is needled vertically or obliquely 1 to 1.5 tune. For its actions and indications, bladder 58 opens its channel and the loop vessels and alleviates pain. It expels pathogenic factors from the Taiyan channel, which includes the small intestine and the bladder. It harmonizes above and below and treats hemorrhoids. For its special feature, it is a loop connecting point of the bladder meridian. Okay. Bladder 58 is used as a distal point in treatment of lower back ache and sciatica. A particular function of this point is to treat sciatica when the pain is somewhat in between the bladder and the gallbladder channel in the leg. Being the connecting point, bladder 58 communicates with the kidneys, and it can be used to strengthen kidneys in conjunction with kidney source points, kidney 3. In particular, this point can simultaneously strengthen the kidneys and subdue rebellious chi in the head, causing headache, dizziness, and stiffness. The point is therefore ideal to treat headaches from liver yang rising but occurring on bladder channel against a background of kidney deficiency. It is also an empirical distal point for the treatment of hemorrhoids, and this point effect on the hemorrhoids is explained by the pathway of the bladder divergent channel which goes to the anus. To summarize, bladder 58 removes obstruction from the channel, which will manifest with lower backache, sciatica, inability to stand, and atrophy of legs. It also subdues rebellious chi from the head, which has symptoms as headache, dizziness, neck ache, occipital headache, and nosebleed. It also strengthens the kidneys for cases of lower backache, tinnitus, and dizziness. It also treats hemorrhoids, as in hemorrhoids, swelling, and painful hemorrhoids and bleeding hemorrhoids. Bladder 58 is the low connecting point of the bladder channel. An examination of its modern application compared with its traditional indications reveals a significant disparity. Clinically, it is most commonly used nowadays for disorders of the lower limb and lumbar pain, particularly for sciatic pain, which is located either along the course of both the bladder and gallbladder channels or between these two channels. This reflects the location of bladder 58 as the place where the bladder channel, which runs down the back of the leg from bladder 36, passes laterally towards the gallbladder channel on the lower leg. Its traditional indications, however, show a much wider application, characterized by excess in the upper region, sometimes with accompanying deficiency below, which is a pattern which may explain the name of the point soaring upward, as well as the alternative name flying young. From bladder 58, the low connecting channel meets with the kidney channel, strengthening the relationship between the coupled channels. According to the Guide to the Classics of Acupuncture, the low connecting points are located between two channels. If they are punctured, symptoms of the inferiorly-exteriorly related channels can be treated. When the kidneys are depleted, there may be deficiency below, manifesting as lumbar pain, coldness of the lower part of the body, inability to stand, and weakness of the legs. At the same time, there may be excessive yang rising up the coupled bladder channel to the head and manifesting as dizziness, headache, pain of the neck and occiput, heat in the head, and nosebleed. As the bladder channel descends towards the foot, its points are increasingly indicated for disorders of the spirit such as mania, and bladder 58 is the first of this. The bladder primary channel connects with the governing vessel at points do13, do14, do17, and do20, where it enters the brain, whilst the bladder divergent channel enters the heart. Since both the brain and the heart have been cited as the residence of the spirit in different traditions of Chinese medicine, these two channel pathways help explain the ability of points such as bladder 58 to calm the spirit and treat disorders of the brain such as mania and epilepsy. When pathogenic factors, principally exterior wind, attack the Taiyang channel, they may give rise to chills and fever, or fever with absence of sweating, as well as various symptoms affecting the head, such as pain of the neck and occiput, heat in the head, nasal congestion and rhinitis, nosebleed, and dizziness. The bladder 58 is a distal point of the foot Taiyang channel, is able to expel pathogens from the channel. release the exterior, and clear the upper portion of the channel. The bladder divergent channel encircles the anal region, unlike bladder 68 and bladder 56 and bladder 57. Bladder 58 is classically indicated for the treatment of hemorrhoids, swollen and painful hemorrhoids, and bleeding hemorrhoids. Finally, the Great Compendium of Acupuncture and Moxibustion gives specific indications for excess and deficiency of the Luo connecting points. In the case of bladder 58, these are rhinitis with obstruction and pain of the head and back in excess, and rhinitis with nosebleed in deficiency. Thank you for your attention.
We continue with the back transporting points, bladder 25, the large intestine tube. Location, bladder 25 is 1.5 June lateral to the posterior midline on the level of the lower border of the spinous process of the fourth lumbar vertebra. How to find bladder 25? For orientation in the lumbar region, first determine the Taffier's line. Place both hands directly superior or lateral to the highest point of the iliac crest, joining the thumbs on the midline of the lumbar spine. In most cases, this line intersects with the spinous process of L4. Note this varies depending on the patient's position. On this level, locate bladder 25, 1.5 June in a lateral direction. Located on the same level are DO3 on the midline, a point of EXB2, 0.5 June lateral to the midline, EXB6, 3 June lateral to the midline, and EXB7, 3.5 June lateral to the midline. Needling, vertically 1 to 1.5 June. For the actions indications, bladder 25 regulates the intestine and promotes the qi flow. It also strengthens the lower back. For the special features, bladder 25 is the back shoe point of the large intestine, important point for regulating the large intestine qi, important local point for acute and chronic lumbar disorders. First of all, bladder 25 point promotes the excreting function of the large intestine and can be used to treat both constipation and diarrhea. For the latter, it is often used in combination with bladder 20. Being the back transporting point, it is specially indicated for any chronic disease of the lumbar of the large intestine. Bladder 25 is also indicated in excess patterns of the large intestine to relieve abdominal fullness and distension. It is also frequently used as a local point for both chronic or acute lower backache. In acute backache, this point is often tender on pressure, and if so, it should be needled with reducing method. Bladder 25 promotes the function of large intestine for those having borborygmy, diarrhea, undigested food in the stools, blood in the stools, difficult bowel evacuation, constipation, prolapse of rectum, abdominal distension and pain, hypogastric pain, umbilical pain. It also strengthens the lower back, those having lower backache, stiffness of the lower back, painful obstruction syndrome, the B syndrome of the legs. Bladder 25 is the back shoe point of the large intestine, where the qi of the large intestine emanates from the interior of the body surface. It is an important point to regulate the function of the large intestine food, and its application is very broad. When the spleen is deficient or suffers from dampness, there may be loose stools, diarrhea, undigested food in the stool, blood in the stool, borborygmus, and inability to gain weight despite eating copiously. In combination with points that tonify the spleen and stomach, bladder 25 is an important point to firm and tonify the intestine. When there is stagnation of qi, blood, damp heat, toxic heat in the intestinal region, there will be distension, pain, cutting painfulness, constipation, intestinal abscess. In combination with other suitable points, bladder 25 is able to regulate qi and dissipate stagnation. When the central qi is deficient or when damp heat sinks downward, there may be prolapse of the rectum. Bladder 25 is a valuable adjacent point used in the treatment of this disorder. In combination with points such as DO20 and DO1, as well as points which treat the underlying disharmony. Finally, bladder 25 is an important local point in the treatment of lumbar pain, and like many points of the lower lumbar region, is also indicated for painful obstruction and atrophy disorder of the lower limbs. Thank you for your attention.
Now let's discuss the primary channel of the lung. The lung channel originates from the middle burner and runs down to connect with the large intestine. It then ascends to the stomach, passes the diaphragm, and enters the lung. From here, it ascends to the throat and then emerges at lung 1. From here, it descends along the medial aspect of the arm and reaches the styloid process of the radius. It then goes to the thinner eminence and ends at the medial side of the tip of the thumb. Overview of lung points. They affect the chest and throat, all stimulate the descending of lung qi, and treat cough and asthma, expel exterior wind. Let's review the pathway of the lung primary channel. So the internal section of the lung primary channel originates in the middle burner in the region of the stomach. It then descends to connect with the large intestine, its paired Fu organ. It curves upwards again to the stomach, penetrates the diaphragm, enters the lung, its pertaining Zhang organ, ascends to the throat region, and curves towards the lateral thoracic region. So the lung primary channel emerges at lung 1 on the lateral thoracic wall at the level of the first intercostal space, travels along the anterolateral aspect of the upper arm and forearm, ends at lung 11 on the thumb at the radial aspect of the corner of the nail. A branch separates from the primary channel at lung 7 at the styloid process of the radius and travels along the radial side of the index finger to its tip, where it connects with LI1, the hand yin-yang connection of the first great circuit. Clinical importance of studying the lung primary channel. Exterior or the Piao signs and symptoms, we have fever, aversion to cold, nasal blockage, headache, pain in the region of the thorax, shoulder and back, pain with cold sensations along the channel. So interior or Zhangfu organ signs and symptoms include cough, asthma, wheezing, dyspnea, shortness of breath, fullness and tightness of the chest, expectoration of phlegm, dry throat, changed color of the urine, irritability, heat sensation in the palms, abdominal fullness and distension and diarrhea. Excess symptoms are shoulder and back pain, wind cold attack with spontaneous sweating, frequent urination, and yawning. Deficiency symptoms are shoulder and back pain with aversion to cold, shortness of breath, changed color of urine. So the connections of the lung primary channel with other channels. Number 1 is the large intestine primary channel. Okay, so the hand yin-yang connection of the first great circuit is the connection of the lung with the large intestine. Location from lung 7 to LI1 on the hand. A branch of the lung primary channel separates at lung 7 and connects with the large intestine primary channel at LI1. According to some authors, it also connects with LI4. So the circulation is circadian according to the organ clock. Importance, interior-exterior relationship. The lung channel also connects with the spleen primary channel. So the connection is paired according to the 6-channel theory. This is the hand-foot pairing, the yin axis of the first great circuit. Location, spleen 20 to lung 1 on the thorax. A branch of the spleen primary channel separates at spleen 20 and connects with the lung primary channel at lung 1. Circulation is non-circadian. That means it's not according to the organ clock. Importance of this connection is above-below relationship. Now, let's talk about the connection of the lung primary channel with the liver primary channel. The connection is deep yin-yin connection. Location, liver to lung on the thorax. An internal branch of the liver primary channel emerges at the liver, passes the diaphragm, and spreads inside the lung, forming a network with the lung primary channel. Circulation is circadian, according to the organ clock. Importance, closes the circle of the first great circuit of the nutritive or yin qi. Now let's talk about connection of the lung primary channel with renmai. Connection, renmai, importance of this connection, it closes the circle of the second circuit of the nutritive qi or the yin qi. The lung primary channel as well as the great circuit, which is the circulation through the 12 primary channels, receives qi from the small circuit. So that's renmai to tumai. Then finally, the connections of the lung primary channel to the Zhangfu organ systems, the lung, large intestine, and stomach. So let's try to get acquainted with some of the major points of the lung channel. Lung 5 clears lung heat, resolves phlegm. Lung 7 releases exterior, circulates defensive qi, stimulates diffusing and descending of lung qi. Lung 9 tonifies the lungs. Lung 10 clears lung heat, benefits the throat. Lung 11 expels wind heat, stimulates the diffusing and descending of lung qi, benefits the throat. So here you would see a very simplified illustration of the connection of the lung primary channel with the stomach, large intestine, and lung. So this somewhat summarizes what we have earlier presented. So here we can see the lung connecting, which is specifically from lung 7. We have the loop connecting channel of the lung to travel to the palm and the thinner eminence. Thank you very much for your attention.
Let's now discuss bladder 59 or instep yang, an accumulation or sheet left point. Bladder 59 is located on the lateral aspect of the lower leg, pre-tuned superior to bladder 60 in the depression between the highest prominence of the lateral malleolus and the Achilles tendon. How to find bladder 59? First, locate bladder 60 in the depression between the highest prominence of the lateral malleolus and the Achilles tendon. With edema of the lower leg, this point is not visible but palpable. From bladder 60, measure 3 chun, which is 1 hand breadth, in a superior direction. There locate bladder 59 in a depression between the Achilles tendon and the tendons of the peroneus longus and brevis muscles. Located on the same level is GB39, 3 chun directly above the prominence of the lateral malleolus. Bladder 59 is needled vertically or obliquely 1 to 1.5 chun. Its actions and indications are it opens the channel and the Lu vessels, it benefits the lower back, benefits the head, and activates the Yang Chow Mai. Special features, it is the streak left point of the Yang Chow Mai, the meeting point with the Yang Chow Mai according to some authors. Bladder 59 is a frequently used distal point in the treatment of lower back ache, particularly in chronic cases with weakness of the leg and back. This point strengthens the muscles and makes movement of the leg easier. The Yang stepping vessel promotes movement and agility of this point in its accumulation point. Hence, the effect of in stimulating movement of the leg and back. It is effective only for unilateral backache. To give emphasis, bladder 59 removes obstruction from the channel, which include thigh pain, painful obstruction syndrome or the B syndrome of legs, atrophy of legs, inability to raise leg, feeling of heaviness of the legs, sciatica, ulcers on legs, redness and swelling of the lateral malleolus. It also invigorates the yang stepping vessel and benefits the back, which includes lower backache with pronounced stiffness. Foot bone yang regulates qi and removes obstruction from meridians. As the accumulation point where blood and qi gathers, it nourishes, invigorates, and tonifies yang chao mai. This point strengthens the muscle and makes movement easier. All qi cleft points are useful for invigorating and dispersing pain or obstruction along the particular channel on which they are found and are much used in acute conditions. Being the qi cleft or accumulating point of the yang chao mai, which is about mobility, being able to stand and move with vigor and precision, and the ability to raise one's leg up, explains its effect of increasing range of movement. This connection with the yang chao mai is why bladder 59 affects the side of the leg, including the muscle tone, and can absorb excess yang qi and wind from the head. Hence the use of this point for facial paralysis and seizures. It can also release the exterior and expel pathogenic factors. Bladder 59 is frequently used distal point for lower backache, especially chronic backache with weakness of the leg and foot. The connection with yang chao mai and indirectly with its partner vessel, the yin chao mai, helps explain why it is not only a great point for detoxifying body, mind, and spirit through its ability to absorb excess yang from the head and release the exterior, but the yin-yang chao mai pairings also have a role to play in balancing yin-yang throughout the body and help to reestablish the natural rhythm and cycles in the person. This yang influence brings cleansing to all parts of the body, mind, and spirit, whether excreting putrid body fluids, as in perspiration and urine, at the level of the body, or helping cleanse the mind and spirit of the distrust, suspicion, and paranoia that can occur when bladder becomes contaminated. When instead of seeing the wonder of life, all a person can see is dinginess in threat, bladder 59 can help balance this experience. So bladder 59 strengthens the back. This point can be very effective for the elimination of toxins from the body and mind, and can be used in combination with Li4 to augment its effect. Considered for rheumatism of the ankle and heaviness and pain in the head, or an inability to raise the arms and legs. It helps to bring a person's natural rhythm and cycles back into balance because of its ability to harmonize the yin and yang within the system. Thank you for your attention.
Now we go to the 4 C's. Stomach 39, the lower great void. Stomach 39 location is 1 Chun distal to stomach 38, midpoint of the line joining stomach 35 and stomach 41, and 1 finger breadth lateral to the anterior crest of the tibia. How to find stomach 39? The quick method, spreading hands technique. Place the little fingers on stomach 35 lateral eye of the knee level with the knee joint space, and stomach 41 in the depression between the tendons of the extensor divictorum longus and hallucis longus level with the highest prominence of the lateral malleolus, and determine the midpoint of this line level with stomach 38 using the thumbs. Stomach 39 is located in a depression 1 Yuan distal and 1 finger breadth medial measure from the anterior crest of the tibia. Lateral to this point, stomach 39 may be palpated dynamically sensitivity. Located in the same level, 7th Yuan proximal to the lateral malleolus are GB35 on the posterior border of the fibula, GB36 on the anterior border of the fibula, and bladder 58 on the lateral border of the gastrocnemius muscle. Stomach 39 needling vertically or obliquely 1 to 1.5 June. For the actions indication, stomach 39 moves the small intestine chi, eliminates stagnation, clears damp heat. It opens the channel and alleviates pain. Special features, stomach 39 is the lower HESI point of the small intestine, C of blood point. Being the lower C point of the small intestine, this point is used for all patterns of this young organ. In particular, it is used for lower abdominal pain with borborygmy and flatulence. It is also used to resolve damp heat in the small intestine with such symptoms as cloudy dark urine and stools with mucus. In combination with stomach 37, it is used for pain in the legs caused by wind and dampness. As a point for the C of blood, it can be used to tonify blood together with bladder 37 and bladder 11. The 3 points, bladder 37, bladder 36, and stomach 39 can treat restless legs. For the summary of functions, stomach 39 being the lower C point of the small intestine, this point is used for all patterns of this young organ. In particular, it is used for lower abdominal pain with borborygmy and flatulence, resolves damp heat in the small intestine, cloudy dark urine, and stools with mucus. In combination with stomach 37, it is used for pain in the legs caused by wind and dampness. As a point for C of blood, it can be used to tonify blood together with bladder 37 and bladder 11. The Yellow Emperor Inner Classic states the large and small intestine fall under the influence of the stomach and classified stomach 39 as the lower SC point of the small intestine. The 3 young channels of the arm, large intestine, small intestine, and sanjiao, are unique in that while the channels traverse the upper jiao, the respective fu belongs to the lower jiao. Thus, although the spiritual pivot states that the HESI points treat disorders of the internal fu, the HESI point of these 3 channels, large intestine 11, sanjiao 8, and sanjiao 10, respectively, have relatively little action on their related fu. The large and small intestine and the sanjiao, however, each have a lower HESI point, stomach 37, stomach 39, and bladder 39, which predominantly treat disorders of their respective fu. Stomach 39 may be used in 2 principal patterns of small intestine, namely small intestine chi pain and small intestine deficient and cold. The former is characterized by severe pain of the lower abdomen, which radiates to the waist and lumbar region and down to the testicles. The latter is characterized by the lower abdominal pain, which improves with warmth and pressure, and chronic diarrhea or dysenteric disorder, etc. Stomach 39 is further able to treat diarrhea and dysenteric disorder due to damp heat, which give rise to pus and blood in the stool. The essential questions includes stomach 39 among the 8 points to clear heat from the stomach emphasizing that as well as being the HESI point of the small intestine, this point lies on the stomach channel and is indicated for heat in the channel, giving rise to disorders such as breast abscess, dry lips and throat, painful obstruction. And usually, stomach 39 is also clearly ascribed some ability to regulate the small intestine channel, reflected in such indication as extreme sensation of cold and heat in the shoulder, heat sensations in the area between the ring and little fingers, and burning sensation in front of the ears. Finally, stomach 39 belongs to Yang Min channel, which is abundant in qi and blood and is similar to points such as stomach 36 and stomach 37 in its ability to treat disorders of the lower limb. It is indicated for painful obstruction and atrophy disorder of the lower limb and foot, hemiplegia, and heel pain. Thank you for your attention.
Still on common cold and influenza, we discuss concept of warm disease or the Wenping. Wind cold is characterized by aversion to cold, sneezing, cough, runny nose with white watery mucus, fever, severe occipital stiffness and ache, no sweating, no thirst, floating tight pulse, tongue body color unchanged, thin white coating. Clinical manifestations of wind heat: aversion to cold, fever, sneezing, cough, runny nose with slightly yellow mucus, occipital stiffness and ache, slight sweating, itchy throat, sore throat, swollen tonsils, thirst, a floating rapid pulse, tongue body red on the tip or sides, and a thin white coating. Wind dampness is characterized by aversion to cold, fever, swollen neck glands, nausea, sweating, occipital stiffness, body aches, muscle ache, feeling of heaviness of the body, swollen joints, floating slippery pulse. For wind dryness, we have fever, slight aversion to cold, slight sweating, dry skin, nose, mouth, and throat, dry cough, sore throat, dry tongue with thin white coating, and a floating rapid pulse. Wind water is characterized by aversion to cold, fever, edema, especially on the face, swollen face and eyes, cough with profuse white and watery mucus, sweating, no thirst, floating pulse. The discussion of cold-induced diseases by Shang-Han Lun by ZHONGCHONG provided the earliest framework for the diagnosis and treatment of diseases from exterior wind cold. Although this famous classic does also discuss invasions of wind heat and their treatment, a comprehensive theory of exterior diseases from wind heat was not developed until the late 1600s by the School of Warm Diseases called Wenping. Thus, the two schools of thought, which form the pillars for the diagnosis and treatment of exterior diseases in Chinese medicine, are separated by about 15 centuries. They are the School of Cold-Induced Diseases, the School of Shang-Han, and the School of Warm Diseases, the Wenping School, which started in the late 1600s and early 1700s. The main advocates of this school were Wu Yuxing, Ye Tianshi, and Wu Tao. What does warm disease mean? The previously mentioned doctors from this school of thought introduced important innovations to the theory of wind in Chinese medicine. The School of Warm Diseases postulates that some exterior pathogenic factors go beyond the natural characters of wind. They are so virulent and strong that no matter how strong a person's body's qi may be, men, women, and children fall ill by the dozen. More importantly, for the first time in the history of Chinese medicine, these doctors recognized that some external pathogenic factors are infectious. This is an extremely important, innovative idea in Chinese medicine, and one that preceded the introduction of Western medicine into China. Previously, it was believed that a person fell ill from an exterior disease because of a relative imbalance between an external pathogenic factor and the body's qi. The doctors of the School of Warm Diseases, on the contrary, realized that some pathogenic factors, although still falling under the category of wind, are infectious. Indeed, some called warm epidemic pathogenic factor are so infectious that entire communities fall ill. A further innovative idea stemming from this school was that the pathogenic factors causing warm diseases, all of them falling under the category of wind heat, enter via the nose and mouth rather than via the skin, as happens for wind cold. Thank you for your attention.